Hi everyone, my name is Felicity Iredale and I'm an associate in Russell Kennedy's Health, Aged Care and Not-for-Profit team. Over the last 18 months, I've been doing a lot of work in relation to voluntary assisted dying, and today I'm going to be speaking about the things that health services should be thinking about following its introduction in Victoria. Victorians who have been diagnosed with a disease, illness or condition that's likely to cause death within 6 months may be eligible to access voluntary assisted dying in Victoria. As you can imagine, health services will be involved in the vast majority of requests by patients to access voluntary assisted dying. This is because the person already must have a disease, illness or condition, so are likely to already have contact with a health service and all associated medical practitioners. The role of health services will depend on the level of involvement that the health service can provide. The Victorian Healthcare Association has released 3 model of care pathways which can be used by health services. At one end, there's a full service which would be used by health services where there are medical practitioners and specialists engaged directly by that health service. Down the other end, there's a referral pathway where the health service isn't able to provide direct support to persons accessing voluntary assisted dying. However, the model of care pathway is not the end of the story. Beyond that, each health service must consider their individual position and then implement procedures to ensure that staff and patients are adequately supported throughout the voluntary assisted dying process. The first thing health services need to do is ensure that they've determined their organisational position and how that will be communicated to staff and patients. This means that health services should determine how many medical practitioners, if any, at their health service are willing to be engaged in voluntary assisted dying and have done the relevant training. If there are no medical practitioners willing to be involved, then referral pathways for patients should be explored. Beyond medical practitioners, health services should also find out who will coordinate voluntary assisted dying requests at the health service and ensure that all care and health staff are aware of their obligations under the new legislation. We recommend that all health services engage in training on voluntary assisted dying for all staff. That means health practitioner staff, medical practitioner staff and other staff. Policies and procedures should also be in place to ensure that all requests for voluntary assisted dying made by patients are handled in accordance with the legislation. If you would like any assistance or advice in relation to voluntary assisted dying, please contact us.